Good afternoon, everyone. Thank you for the introduction. My name is Kwizera Christopher. I head the Uganda NCD Alliance. The Uganda NCD Alliance is a civil society organization that was founded in 2009 with a purpose of fighting non-communicable diseases in the country. By then, the NCDs had become a challenge, and there was need to champion the fight, and of course there was a space and a vacuum to fight non-communicable diseases. Of course, we know that the healthcare system of our country, like any other developing world, is crafted on the infectious diseases or communicable diseases, but also it's more on clinical care or treatment. And there is less attention, or there was less attention to non-communicable diseases or even to prevention. And because of that, as we continue to fight infectious diseases, the non-communicable diseases are also on the increase, and nobody paid attention. And of course, there was a notion that non-communicable diseases are either diseases of the elderly, and after that shift, they are also looked at as diseases of the rich. Of course, that was looking at diabetes, hypertension, and other cardiovascular diseases, then also chronic respiratory diseases and the cancers. Gone are the days when people think that cancers are either diseases of the elderly or diseases of the rich. So as diabetes, which was also associated to the people who are obese, literally the people know that we also have type 1 diabetes, which is literally known as the juvenile diabetes or disease of the underage. As a result, UNCDA was founded with support from the Danish NCD Alliance, using funds from Danida and the Civil Society and Development of Denmark, but also mobilizing Ugandan-based organization, that was Uganda Cancer Society, Uganda Diabetes Association, and Uganda Heart Research Foundation then. So the three organizations allied together and formed the Uganda Non-Communicable Diseases Alliance to be a lead partner with Ministry of Health to champion the fight against non-communicable diseases. Since then, we have not looked back. We have continued. We have seen a lot of developments. There has been a number of policies that have come in place to fight non-communicable diseases. Key on that was the development of the NCD department at the Ministry of Health. By then, it was only a desk that was manned by one staff, but right now, the Ministry of Health has a fully-fledged department with 2 divisions, whose work is to look at the NCD situation in the country. And as an alliance, we partner with with the Ministry of Health through that department to ensure that we fight non-communicable diseases. And that's what I can talk about to the history of the Uganda NCD Alliance. Of course, if I go to statistics, we all know that the Global NCD Alliance accounts for over 70% of all deaths, but also more than 30 million die due to non-communicable diseases. And of course, the leading cause of death among NCDs is cardiovascular diseases. And in Uganda, NCDs are responsible for about 34% of all deaths, and the leading again still being cardiovascular diseases. We know that whereas they are responsible for 34% of all deaths, the resources available to prevent non-communicable diseases are inadequate. Like I said, our healthcare system is still crafted on the on the communicable diseases, and we are still fighting to ensure that we bring resources in the same proportion like the problem. The problem of NCD is much bigger than infectious diseases, And all of us know that. If we normally, as we are talking, I always want to throw a question to all of us. I wouldn't want an answer. That you look back and you know the last 4 burials that you've heard about. Those people whom you know, who are known to you, whom you are connected to, who died. And look at the cause of the death. The 4 that you've had in the previous period. Look at the cause of death, you realize that NCDs are the biggest cause of their death. So, as we plan at individual level, we should be looking at the non-communicable diseases as the biggest priority that we should be planning for. And when we looked at NCDs, we are looking at the big 4. That is heart diseases, diabetes, cancers, and chronic respiratory diseases. And these diseases, basically what's common with them, they do not have a direct cause, apart from probably where we want to look at the genetics. And what we look at is the risk factors, and these risk factors are behavior. Smoking and use of tobacco, excessive use of alcohol, physical inactivity, and unhealthy diet. And all those we can control them at personal level before even start looking for medicines. The other characteristic of these diseases being chronic in nature, they do not have direct signs and symptoms. By the time you get to know that you have diabetes, if you have not been in the habit of doing a medical checkup, many times it's a bit too late, or it has caused, or probably they are diagnosing a complication, not diabetes per se. And I always tell people that if you went to, of course there are signs and symptoms, people who are in the clinical world, that they tend to tell you that you know when you have diabetes, ABCD will happen to you, have a problem with your eyes, you have a problem with urinating. All those, if you go into details, are basically complications at that level. So we always do not want to advise people to start teaching people the signs and symptoms. What we normally advise people is that every time you go to a health facility, you get in touch with the health care system, make sure your blood pressure is checked, you do a random blood sugar check, and at least make sure you get information about cancer. If it requires that it's a cancer that can be screened, get screened, so that you periodically have yourself checked, because if you wait for the symptoms, it might be too late. So that's how far we've gone with the population that we work with. So what does UNCDA do? Somebody was like, I should be able to tell people the opportunity of other civil society organizations to work with UNCDA. As an organization, from our inception, we had mainly 3 agenda program. One was creating awareness on NCDs as a problem or as a disease. Number 2 was creating awareness on risk factors of NCDs. Then number 3 is advocacy with government for NCD prevention and control resources. And as an organization, of course, we're a civil society organization, and we typically survive on grants and funds from funders. We're able to open up branches in about 13 districts that are scattered in all regions of the country. We are in northern Uganda, in Igulu and Arua. That's Great Arua before it was chopped into so many districts. But now there are about 5 districts in that region. In Igulu, we are there before Agulu was chopped into Amuru and the Gulu city and then the Gulu district. Of course, there's one other district that was also chopped from Gulu. Then in eastern Uganda, we are in Amuria, Serere, Tororo, and Iluka. And then in western Uganda, we are in Mbarara, Bushenyi, Mbara district, Mbara, Bushenyi. The other one is Shema and Kasese. Then in central, we do a lot of work in Nakasongora, Mubenda and Kasanda. Then of course Kampala Metropolitan, including Wakiso. Those are the regions, those are the branches that we work in. Although we should be doing our work across all entire country. But of course also know that there are so many other partners who are doing work related to non-communicable diseases in different points and areas. And then as an organization, we also do a lot of advocacy with the Ministry of Health to ensure that there are policies and strategies that are in place to fight non-communicable diseases. And our partners, like I said, having aside from our members, the Cancer Society, the Diabetes Association, the Health Research Foundation, Stroke Foundation in Uganda, Uganda Alcohol Policy Alliance, we also have other organizations, the Sickle Cell Organization that work with us, the Uganda Health Alliance, always work with us as members, but also partner with local governments in the branches where we are. We partner with the academia, and then other health facilities to be able to champion the cause of fighting non-communicable diseases. But we are a lead partner with the Ministry of Health, representing all civil society organizations that are championing the fight, that are in the fight against non-communicable diseases. And then outside the country, we are partners, or we are members of the East Africa NCD Alliance, together with the 5 national NCD Alliance of Rwanda, Tanzania, Kenya, Burundi, and Zanzibar. We form the East Africa NCD Alliance. And the East Africa NCD Alliance we have an umbrella there that helps us to focus on advocacy for NCDs at the East African community level. Then together with other blocks and national NCD alliances within Africa, we formed the Africa NCD Network. And the Africa NCD Network champions the cause of NCDs at African Union, the African Union level. Of course, from there then we also form, or we are members of the Global NCD Alliance that of course helps us to reach the UN organizations, or the UN organ. So that's how, as an alliance, that's how we exist and that's how we live. So we are open and we want everybody who has the heart fight non-communicable diseases to join us. For now, I think that's what I can talk about the Uganda NCD Alliance and what we do. We are doing a lot of work. We are still in space to do screening for non-communicable diseases where we have resources. We do a lot of awareness creation using mass media and social media to ensure that we reach everybody, including those of us who are in this room. And then, of course, we are also working with the media personnel to ensure that everybody gets the information and also everybody fights non-communicable diseases. I must emphasize that the fight against non-communicable diseases starts from an individual. Otherwise, I want to thank you so much for listening to me.